to do the same thing. Just find those two spots because the skin moves and we're there. Okay, and now stand on the right leg. Now, that's a bit harder to even get yourself started, isn't it? Okay, and now do 5 for me. Nice, that's it. Up and down, try to do it a bit faster. 3, 4. Did that feel different to you to the other side?
Yeah, it was harder.
It was harder. Any pain?
Not pain, just a tightness.
A tightness in the area that you get your pain? Great.
So a couple of questions with that one, Trish. The first is that you've got Kate's heels up on a decline board there. So why do you do that?
Again, that came from screening a wide group of patients and athletes. There's research that shows that limited dorsiflexion is one of the most common false positives for a dynamic Trendelenburg. So by putting just her heels on a decline board, it takes that false positive away. And it challenges their balance ever so slightly, but I don't mind challenging their balance because you can see their balance becomes part of the issue if they do have a problem.
The other question I have is for both the first test and this test, you've also palpated and you've kind of been feeling. For me, I would normally do this where a camera person would be, and I'd be looking at it, with my eyes rather than feeling it. So,
and I'm not feeling.
Right.
I'm using my fingers. I'm not feeling because I don't think you can feel SIJ movement, Randall. But I do find that sometimes if you put piece markers on, and particularly with women who have had a few babies, skin moves quite a lot. So I'm using my fingers as markers. So I don't think you can feel anything, would be my opinion. There may be greater physios than I that can, but I think whether you do it standing back and looking or putting your fingers there, I think you're doing the same thing. You're creating a visual mark.
So
I'm not feeling for anything.
So if the camera was not there, would you be looking at it from where the camera is, or would you still have your hands on the patient?
Usually I would hold their hand and be looking at them from behind.
I see. Okay.
Yeah. So I'd probably put my fingers there as a visual marker.
I get it.
But some of these women, more women than men, but have a real anxiety standing on one leg because so often having your hand there, even if they don't need it, but they know that you're there, can make a difference. Okay, so now they're functional weight-bearing tests. So things like a pronated foot, a stiff hip, all of those kind of things can give you false positives. So it's good to then link that to something that is non-weight-bearing. So really, when we look at active straight leg raise, and there's been quite a bit of validating research looking at this, particularly in pregnant women, and this gives 2 points in the algorithm. One is the first one, if it's positive for pain or heaviness, and the second is if compression makes a difference.
Okay.
So we'll go through the first one. Okay, this is, again, a researched test called the active straight leg raise test, and we'll do it first off just as gentle as possible. So I'll get you to lift your left leg up to touch my hand and back down, and lift your right leg up to touch my hand and back down. So I'll get you to do a couple of them. So lift up and back down, and lift the right and back down. Does it feel different to you, one leg versus the other?
Yeah, the right leg feels heavier to lift.
It feels heavier, that initial lift. Is there any pain with that?
There's pulling.
Pulling in that same area in your lower back? Yep, great. Because pulling at the front that's more indicative of your hip, but it was pulling at the back.
Yeah.
So that's the most sensitive way of doing it. Now, reproducing pain or heaviness. Now, I might use Ryan for the athletic one. I'll show you because with athletes, you ask them, you ask a rugby league player, does the leg feel heavier? And they'll look at you as if, what do you mean? So often, and I tend to see a lot of tertiary referral of rugby players, AFL players, and so we've developed more of a loaded one. Whoop. This is the loaded test. But what I'm going to do is my hand exactly the same, above the greater trochanter and pressing in. But I'm going to add some resistance because you're a Gaelic football player. So let's say you had some issues, but just getting you to lift one leg and down and lifting your right leg up and down, you say, well, I can't notice any difference. So we can add some load to that with a long lever. So what I do is I add the compression. I'm going to bring this up, and I like to add a bit of compression. So what I'm going to do is put my elbow on my pelvis, just above the greater trochanter, just like with Kate, compress in, but don't push them off the bed. Not ridiculous compression, okay? Just so it feels comfortable, you're okay. You don't want to provoke their pain either. Lift this leg up for me, hold it at 30 degrees. I add some pushing down, not ridiculous because you've got a long lever. And then what I'll do is leave my hand there but take the compression away. And is it harder to push up against my hand compared to when I push that compression on? So that should make it easier to push up against my hand, and I take away the compression. They keep pushing up, but it's harder. And often they'll say, oh, that feels much harder and I'm using my quads more. So for someone who's athletic, like Ryan playing Gaelic football or AFL, that's actually a much more functional way to do an active straight leg raise. So one is if it feels heavier than the other or weaker than the other, but also if compression makes a difference. So can I quickly go back to how we did it with Kate, and then we can discuss it. But what I'm now going to do is add compression on both sides and see if that changes things, and then add compression on one side and see if that changes things. Okay, so I'm going to put my hands just above your greater trochanter, and I'm doing this on both sides. You can only see the left. And just above the greater trochanter, I cup my fingers under the pelvis and I push in like that. So now just lift up your left leg for me and back down, and lift up your right leg for me and back down. Now I'm going to leave my hands there but take the compression away and do it once more. Lift and back, and the right one. So when I compress in, does it help?
Yeah.
It does help.
It's
easier. So now that's a compression on both sides. I'd be interested to see, because you don't have any symptoms on this left side, if even just a bit of compression on the right side makes a difference. So I'm going to do the same thing. Hand just above the greater trochanter, a little bit posterior, and push in, so you're providing a bit of dynamic compression. So I'm being a little bit of a stabiliser or support for that pelvis. So now lift your left leg up and back down, and lift your right one up. Yeah, that felt good. Easier, okay. And I'm going to get you to do it one more time with my hand there but not pushing in. Lift up your left, and back down, and lift up. You can almost see your brain has to think about it, doesn't it? And it seems such a subtle thing, but when you can't do it, you can't do it.
Yeah. Okay. So just going back to the algorithm and the score, what's obviously compressing the pelvis, so it's either pain or not pain, kind of in that. How do you score
really
it?
Good, Randall. You score it. It gets a point on the side of the symptoms.